Let us start the session on the government schemes for palliative care. This palliative care, that it was included in the National Health Policy of 2017 by the Ministry of Health and Family Welfare, Government of India. Before going to this session, I am really thankful to Dr. Dinesh Kumar who prepared the PowerPoints. This National Program for Palliative Care. Ministry of Health and Family Welfare, Government of India started National Program for Palliative Care, that is NPCC, in 2012. There are many existing programs which has palliative care as a component. They are National Program for Health Care of Elderly, that includes palliative care for geriatric population. National Health Policy 2017. State palliative care policy includes palliative care by public health sector. National AIDS Control Program, that means palliative care for HIV and AIDS patients. National Tuberculosis Elimination Program. Now this program is upgraded to revise the National Tuberculosis Control Program. Ayushman Bharat Yojana, that is health and wellness centers at the primary health center and community health centers, where the palliative care is imparted. It is the major component of all these primary health centers and community health centers. National Program for Palliative Care, that we said that that it started in 2012, and it is a part of the Flexi Pool under National Health Mission, integrated with the National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Disease and Strokes, that is NPCDCS. The goal of the National Program for Palliative Care is availability and accessibility of rational, quality pain relief and palliative care to the needy as an integral part of health care at all levels in alignment with the community requirements. To say about the objectives, the key objectives of the program are as follows: improve the capacity to provide palliative care service and to deliver within the government health programs, refine the legal and regulatory systems, that means support implementation to ensure and access the availability of opioids, encourage attitudinal shift among healthcare professionals, that means by education, by continuing medical education, promote behavior change in community, develop national standards for palliative care. The major strategies proposed are provision for funds for establishing state palliative care cell and palliative care services at the district hospital level. You can go to the link National Program for Palliative Care for further information. National Program for Health Care for Elderly. Here that provide accessible, affordable and high quality, long term, comprehensive and dedicated care services to an aging population. Domiciliary visits by the rehabilitation worker for bedridden elderly and counseling the family members for care such patients. So, some operational guidelines are for this. National Program for Health Care of the Elderly, that is NPHCE. And we can say that the National Health Policy about 2017, it has its own component of this palliative care. It recognizes the growing need for palliative and rehabilitative care for all geriatric illness and educates the community of care across all levels. And to say about the objectives, improve health status through concerted policy action in all sectors and expand preventive, promotive, curative, palliative and rehabilitative services provided through the public health sector with the focus on quality. So, it is there in the National Health Policy of 2017 of Government of India, this Ministry of Health and Family Welfare departments. See, look into the different the south states including Kerala, Karnataka, Maharashtra have a very good care policies there in the palliative sector. And to say about the national health policy in the palliative care, an enhanced capacity building related to palliative care both in health service and training. The palliative care has also been considered to be the part of right to health care by the policy. So, here now the comprehensive primary health center, they have to prevent the disease, they should be promotive in this health sector, and they have to give curative treatment to the patient. And the other major component of this CHC or primary health center is palliative and rehabilitative work. To say about the national control of AIDS control program, lot of things are there, and this palliative care for adult and children with HIV, it is also included in the national AIDS control program. It is one of the component of the national AIDS control program. The palliative care as an important component, just as I said, and the focus is on symptom management of patients, psychosocial, spiritual and bereavement support for the both patients and family. Because it is needed, the bereavement after the death of the patient or so bereavement is a very important part of the management of the palliative care. Home care has been considered to be of great importance in meeting the palliative care needs of HIV positive patients and families. Children, both HIV positive and negative, have been identified as special focus group. Peer counselors, outreach workers, link worker and ASHA workers are expected to play an important role in palliative care. And this National Tuberculosis Elimination Program or the present revised National Tuberculosis Control Program, it also has a component that is palliative care. So, we can see that palliative, in that book, a very good description about the palliative care is there in the National Tuberculosis Elimination Program. In that, in the sixth chapter, it says that palliative care is a multidisciplinary approach to medical care for people with serious illness. It focuses on providing patients with relief from symptoms, pain, physical and mental stress of the serious illnesses, whatever may be the diagnosis, and WHO defines palliative care as an approach that improves the quality of life of the patient and their families facing the problem associated with the life-threatening illnesses through prevention and relief of suffering by means of early identification, impeccable assessment and treatment of pain and other problems, and their physical and psychosocial and spiritual aspects. The goal such therapy is to improve quality of the life of both the patient and the family. It is very important. When we treat the patient in such a condition, we have to take into consideration the family members also. And to say about the need of palliative care in drug-resistant tuberculosis. While high cure rates are there in tuberculosis, it is reported that majority of the program across the globe, in many countries the drug-resistant tuberculosis remains a life-threatening condition with high mortality and poor cure rates. There is a significant suffering associated with the drug-resistant tuberculosis illness and its treatment. This kind of burden adds to the possibility of tuberculosis patients not being able to adhere to the treatment and resultantly the treatment failing to cure them. The life. So, in that case also we have to give some palliative care to the patient and to the family, that we have to look into the whole family who the patient where the patient belongs. And the second chapter says that the palliative care is a multidisciplinary approach to medical care for the people with serious illness. It focuses on providing patients with relief symptoms. We can say about the challenges in palliative care, the challenges in palliative care that we have to know. Current tuberculosis treatment strategy is based on a patient-centered approach to care, and current TB treatment strategy is based on a patient-centered approach to treatment and care, and international guidelines have identified practices resulting in better treatment outcomes. However, alleviation of the patient's suffering associated with the disease and its management has been restricted mostly. And it is more in physical aspect and in its mental aspect. Difficulties faced by patients and families affected by the life-threatening diseases across the physical, psychosocial and spiritual aspects that have to be addressed. Neither trained health workers nor local community based palliative care resources are available in the settings that are mostly needed. Although clinical expertise in palliative care for patients who die in respiratory disease has developed considerably, and individuals with drug resistant tuberculosis are yet to see the benefits. That what we can do as a supportive measures in palliative care. The details of palliative care supportive measures are summarized below now. Respiratory rehabilitation. Relief from dyspnea with oxygen may be used to alleviate shortness of breath in some patients, but there is no significant evidence to generalize its practice. Physiotherapy, evaluation for surgery, respiratory rehabilitation including yoga, etc. are to be considered. And to say about the approach of palliative care, need for human resource and infrastructure is needed. Palliative care is provided by a team of physicians, nurses and other health professionals who work together with the primary care physician and referred specialists. This is to provide an extra layer of support. Hence, palliative care is to be initiated by those non-drug resistant TB centers in various states. Further, this non-drug resistant tuberculosis center staff can counsel and train family members and their caretakers of the patient, so that these services are extended as home-based palliative care to patients by family members or caretakers. All health workers must receive training in palliative care to enable them to extend support to the family members or caretakers providing home-based palliative care and to undertake regular contact tracing and extend support to address their problems. Existing expertise from palliative care, HIV and respiratory medicines can therefore translate directly to TB centers also. Delivery of palliative care from within respiratory clinical services by existing staff with additional training with the clear criteria for referral palliative care specialist is needed. This national tuberculosis, this also is national, that identified the unmet palliative care needs of palliative care, identified the unmet palliative care needs of the palliative care, especially in those suffering from drug resistant tuberculosis. It is a very important part of non-drug resistant tuberculosis patients. Palliative care would be offered through the nodal drug resistant tuberculosis centers or at the community level under the guidance of nodal drug resistant tubercular center. Necessary services include pain relief, psychosocial support, respiratory physiotherapy and nutritional supports. In the Ayushman Bharat Yojana 2018, it has two components. One is Pradhan Mantri Jan Arogya Yojana, that is a health insurance scheme. A comprehensive primary health through health and wellness centers. It was included in the 2018 Ayushman Bharat Yojana. And its palliative care has been included as an expanded range of services along with the health care of elderly, support to families in palliative care and availability of basic pain management and palliative care services through health and wellness centers. There is provision for referral services also. There are different components of Ayushman Bharat Yojana. To say about that, that expanded range of services are there. One is care in pregnancy and child both, neonatal health care services. In this palliative care, we need the community supports, and it is very well practiced in Kerala. In each and every district, we have palliative care units. Thank you.